On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block here at the ACC annual meeting in Washington, D.C., and I'm here with Mohammed Abdel Wahab, who is from Germany, although his name doesn't sound like that. He's actually from Egypt, but he's working in Germany and has done perhaps one of the big blockbuster trials of this meeting, which is the CHOICE trial. So Mohammed, tell me what CHOICE is, and then we'll get to the findings.
So CHOICE was an investigator-initiated, multi-center randomized trial that has been performed in 5 German centers in patients with high-risk aortic valve stenosis that were randomized in a 1-to-1 fashion to transfemoral transcatheter aortic valve replacement with a balloon expandable device versus the same procedure with a self-expandable device.
Okay, so just to help the critics or get rid of the critics, these were sequential patients, I'm assuming?
Yes.
Okay, so randomized trial, core valve against the balloon expandable SAPIEN, and I guess the next question is, what'd you find?
Yes, what we found, and we used the SAPIEN XT valve, which is a newer generation of the SAPIEN valve. We found a higher rate of device success, which was the trial primary endpoint, in the balloon expandable valve group, which was an endpoint that was assessed immediately after the procedure. This is a composite endpoint, including many variables, but most importantly, to a device to be successful, the implantation has to be complete without moderate or severe prosthesis regurgitation and with implantation of only one valve. And exactly these 2 variables occurred less frequently in the balloon expandable group, which was the reason why device success was higher.
Okay, so I'm going to ask you sort of early on in this interview what you learned from the trial, because I want to have a little conversation with you about what this really means. So tell me what you learned.
What we've learned is that, at least for the short term, the balloon expandable device is probably associated with more predictable results. So less leaks and almost no patients, only 1 patient required the implantation of a second valve, which was not the case in the self-expandable group, although the results generally with both devices, even regarding this primary endpoint, were much better than we anticipated.
Okay, so there you have it for what Mohammed learned, but I want to have a little conversation about what you think this really means, because there's a lot of discussion about the core valve outcome data, the differences in mortality at 1 year between surgery and the core valve, and so forth. I personally don't think that there is anything that can be compared here, but I'd like your view on that.
This is true. So comparing different trials will be very difficult, and I don't want to do this. But first of all, let me say that the results of the trial presented yesterday, the randomized core valve trial, are exciting to all of us and will probably change the field dramatically, not only in the States but also in Europe, and will facilitate a lot of discussions within our local heart teams, if I may say this. But on the other hand, if we are going to move to intermediate or even lower risk patients, you want to have a perfect result. And this is why it's important to have multiple devices to choose from and to do rigorous randomized clinical trials to compare the effectiveness of these devices.
So one last question, which obviously everyone's going to ask, and that is, you are hopefully going to follow these patients out looking forward from CHOICE.
Yes, of course. Follow-up is planned at 6 months, 1 year, and then yearly up to 5 years. And we're looking forward to try to complete these follow-up data as much as we can.
Okay, Mohammed, so for me, what you told me, just to give everybody a summary, you think that the balloon expandable valve is more reliable, gives you perhaps a little bit better immediate outcome. You have to wait and see what happens with your long-term outcome, and it just gives us, with the core valve data, multiple options, which is exactly what we're looking for. Fair enough?
Fair enough.
Thank you, Mohammed.
Thank you very much.